Welcome to the Modern Day Naturopath Podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back. This is Dr. Sue. This is the Modern Day Naturopath Podcast. Today, I have a very special friend, Alina Kanner, on to talk about postural restoration. This is a topic I personally do not know a lot about, and being in the holistic health space, I thought it was amazing to bring her on to talk about something that is actually benefiting so many people the more I speak to you. So welcome, Alina. Thank you so much for joining.
Thank you so much for having me. I'm so excited to be here.
Of course. I met actually Alina through a friend of ours, right? Veronica Leslie. She's Health Doll on Instagram if you don't know her. We were like kindred spirits. We met, right, at a Malibu restaurant in California, and she was a former New Yorker. So excited to talk to her because I am a New Yorker, moved to California, and she's still in New York, but it was not so happy about being still in New York.
We had a good time at that meal.
We had a very good time. And Veronica basically brought us together because we're all different healthcare practitioners and we didn't really know a ton about what we all do. So I want to ask you, postural restoration, this was something that you just were like, one day I woke up and I said, I'm going to do this, or what was your inspiration to start doing this? Maybe tell me a little bit more about your background. And actually, before you do that, I do want you guys to pause and follow Alina on Instagram. It is Alina, Aleena, Kanner, Kanner. She has amazing reels. They're super interesting. She gets a lot of, how could you say it? Controversial type commentary, which I love to read because her content is so fascinating that everyone has something to say about it. And so it's so educational. So please follow her there. And then you can also learn more about her Rooted Well platform, which she will talk a little bit about later. But tell me a little bit more about your background when you were younger. I know you were a bit into gymnastics and how this kind of led to you learning postural restoration.
Okay, perfect. Well, thank you for the compliment. I like to talk about controversial things on Instagram that are not like crazy, like controversy is everywhere, right? But I try to find things that people don't know about at all. Like your posture is something and pieces of that. So I appreciate the compliment. So how I got into PRI and my background. So I was a gymnast growing up, and I was not a very competitive gymnast. I mean, I would have loved to be, but I struggled with school. So my parents did not let me pursue the avenue as much of doing like gymnastics because that's what I wanted to do. Instead, I come from a nice Jewish family and you're supposed to be very good at academics. So that's what I had to learn how to figure out. And I did not like school. So I think I learned a lot of my personality was developed from the idea of like that I really don't like school. And I learned about the ideas of authority at a young age. And I hated the fact that I had to raise my hand to go to the bathroom. I was always like, and had inner turmoil about it, but I was always a good kid. So I never said anything. It's actually funny when Veronica did my bioresonance scan, fear, it comes up like different fears. Fears was school for me.
Really?
And I absolutely love learning. So it's really a little bit like of a contradiction to hate school but love learning, because I love learning in my way of learning, and I cannot learn like necessarily like everybody else can. So I have found the way to make it work for myself. And through a lot of struggles, I ended up studying something called athletic training, and I'm a certified athletic trainer. So what that means is whenever you watch a sports game on TV or a high school game or a professional game or I said high school, college, any sort of athletic event, there are athletic trainers there that are tending to the athletes. They work with them if there's an emergency. They work with them in, before surgical care, if they have to have surgery after rehab. So pre and post-op for any sort of surgical situation. And yeah, we work with on the field play and off the field play, and we help athletes get back to sports safely. We're also really big in the emergency realm because athletes do have emergency injuries. And with athletic trainers, we're able to help prevent a lot of deaths, to be honest, that happen right on the field. Yeah. So I went to school to study that, and I got my master's in that. And that is something you can only do that profession if you have a master's degree. So in school, my goal was to work for USA Gymnastics. And that was also around the same time that all this crap was coming out about USA Gymnastics, where there was a lot of controversial issues with the team physician. And I had heard about it a few years before because I worked for gymnastics there, and I had heard about it through the grapevine there. And I had athletes that had suffered issues and different things there. So I'd already heard about it beforehand. And so I was going to do an internship there, and I kind of pulled back and I was like, nah, I don't want to do an internship with USA Gymnastics. Also, I don't even think it would have ever worked out. So when I was in school learning all this stuff, I also realized these athletes were really treated more like dollar signs and not like true people. Because true people, we care about their long-term health. We don't just patch somebody up and say, hey, go and compete on a broken foot, for example. And that's what we do in college athletics and professional athletics. And I just didn't want to be involved in that. So I gave up the dream of working for USA Gymnastics and instead found the dream of actually helping people with their long-term health and longevity. And one of my classmates at University of Arkansas, he said something to me about that I'm never going to do this. I'm going to do one-on-one care. He thought that it would be too hard for me to manage a team and not be able to really help that person in front of me and just kind of help 13 to 20 people instead of really truly being able to make life-changing changes for people. So I ended up hearing about PRI through him. And then when I got out of school, I dove into it more because it was the only thing that sounded different than other things on the market. So I had heard about all these other modalities, but PRI always stuck out to me because they have an integration with vision and dental. And I always thought that was fascinating. And they talk about the asymmetries of the body, and no other modality goes this in depth when it comes to asymmetry. So yeah, that's kind of my background, and we can get into what that means and all that. But yeah.
Yeah. And knowing you now, I do agree with him that you shine in this one-on-one kind of dynamic, you know? So Alina is seeing clients both in Long Beach, Long Island, in New York, as well as Manhattan. Yeah. And just knowing your personality and how much you want to help and how much this does fascinate you, I can hear your passion when you tell me a client's story, or we're trying to collaborate on someone. So I do think you found your let's say your niche. And I like how you said it was fascinating to see about the asymmetries because no one else is really talking about that. So if you had to sum up postural restoration in maybe layman's terms for people first of what that actually is, and then maybe we can talk about, well, why would I even go to someone for something like this? And what does it actually look like to go to someone like yourself?
Yeah, great questions. So in layman's terms, postural restoration is the science that looks at human asymmetry and what that means to our brain. So our brain controls all of our movements. We know this. It controls autonomic function, but it also controls how our body perceives space. And how we perceive space is going to dictate if we feel safe to move. So when we walk, for example, the best way to explain this is sometimes through the visual system. If we are missing a piece of our visual system, if we're missing a little peripheral vision, our body's not going to feel safe to walk anywhere towards that position. However, we also have this internally. So if we have different asymmetries and we're very thrown off, where we're really over on one side of our body more, or utilizing one half of our system more, we're not going to feel safe when we walk and actually functioning over that other half of the system. So what we typically see, and what this asymmetry talk really goes deep into, is that our right side of our body, our right half, if we take a human body and we split it into two, we have a diaphragm on the right side of the body that is bigger, stronger, and attaches lower into the lumbar spine. Nobody learns this in school about the diaphragm asymmetries, but the right side of the diaphragm is bigger. And when we learn in PRI, we learn that it's called a hemidiaphragm. We actually name the two sides differently because the right side and the left side are just so significantly different. So we have that asymmetry, and that asymmetry right on top of your right diaphragm, you have that liver. So that liver is really 3 pounds on average for most people. So it's really heavy. So we have the liver, and we have 3 lobes of lung on the right side of the body and only 2 on the left. And so this is natural internal human asymmetry. You have a heart that is on that left chest wall, but it really keeps that left chest wall very open. So what we see is that because we're heavier on this right side, we see more compression into that right rib cage. So we notice more people will have a lower right shoulder and a higher elevated left shoulder, and their chest will be more hyperinflated on the left side and more compressed. You'll see a divot right underneath your clavicle on the right side. And if we don't manage these asymmetries, we'll get stuck in different positions with the inability to shift. So it's like day and night. We have to have moon and sun. We have to have yin and yang. We have to have right stance when we are walking and standing on our right leg. And then we have to have left stance when we're walking and standing and moving on our left leg. What I see in a lot of people is because of these internal asymmetries plus our brain asymmetry. We have a lot of brain asymmetries, and that's normal. And all these asymmetries are normal and they're good and we need them. We won't be able to flow and move and have rhythmic movement. But if we don't manage them, which we struggle with in modern day society, we'll get stuck where we can't oscillate right and left. We can't get night and day. We're only in daytime, or we're only in yin and we can't get to yang. So it's like with anything, when it comes to balance, we need homeostasis. So what my job is how do I get that person to get to neutrality where they can operate right side, they can get to their right side, organize their body over their right side, come to center, and then get to their left side and organize their body over their left side. And so, for example, when we stand on the right leg, that pelvis on the right has to ever so slightly tilt back. That rib cage on the right has to come down and in, and the head and neck has to center over that right side of the body. A lot of people are naturally over here. We have to be able to do the same on the left side of the body. So we have to be able to elevate that rib cage ever so slightly into external rotation on the right and depress it into internal rotation on the left. But when we are so asymmetrical and we don't do other things to manage it, we get stuck and we get stagnant and we cannot move from side to side. And that's when I see complications, pain, injury, dysfunction, because it's not just about pain. It could also be about hormone issues because you have bones inside your cranium, and then we'll see them stuck where they're more over the right leg. They're oriented and positioned as if they're in right stance in the head. So that's where this gets really, really specific. It merges with craniosacral therapy. It merges with vision and the optometry world, and it merges with dentistry and the dentistry world, the myofunctional therapy world. So I work in an integrative fashion with all of those other providers because in order for me to get that person neutral, everybody's neutral might take different sensory impacts. So for me, it might just be that I need one breathing technique. But for, I don't know, you might need more. Who knows? Everybody is different. And that's where I come into that middleman position to work with other providers to ensure that that person can get to a sense of homeostasis and safety.
That sums up everything I've been looking for to hear, because I've heard pieces of this, but I've never heard it as eloquently from start to finish. And it makes complete sense, right? Because we're looking for this complete symmetry, but you're just like you said before, there has to be some asymmetric, within the body. Like you said, there's this flow of it. And I also liked how you said for one person, it could just be all they need is a breathing technique.
Yeah.
Whereas for someone else, they may need a compilation of different practitioners or different tools. So would you say that people stumble upon you because they have done everything and then all of a sudden they find out about this? Because I know as a naturopath, I'm the last resort doctor, unfortunately, because, when we're in New York, in a place that, like California is a little bit more like where I am now, people are into more holistic medicine. And I don't want to say that no one in New York is into holistic medicine, but it's a little bit more of a lifestyle here because of the weather and the nature and the movement that people do. But we happen to be this last resort doctor in the sense of not everyone hears about a naturopath. So in your position, do you find yourself almost being like that last resort? And how do they end up finding you? Do they just come across one of your awesome reels on Instagram and be like, oh, what's that? I need that? Or do they then, because of the people you work with that are kind of that know about PRI, like the dentist, like you said, those other practitioners who may know about vision, that they then refer them to you? Like, how do people actually know I need to go to someone for postural restoration?
Yeah. In New York, I do get referrals from both dental, vision, myofunctional therapy, and I also get a lot of personal trainer referrals. So if I treat one personal trainer, then I see their entire patient list, usually their client list, I should say. That happens. That happens a lot, especially if they are trying to train somebody and that person like can't feel certain things and they're just trying so hard to train them and they know something else is off. Usually the personal trainers that do refer to me, they're very intelligent personal trainers. They've maybe taken a course or two themselves in postural restoration. I do get a lot of business from Instagram. I do help a lot of people based off of them finding me through like one or two reels, or maybe they followed me for a while and they're just like, this makes more sense. And I've never heard anybody talk about it. And this makes more sense. I try my best to kind of break down these complex things that I've learned because they're very high level and very complex, and take it to a point where I can make it more digestible. And even when I talk to my patients, I do not give them all the details about what's happening in the cranium, because sometimes I might not exactly know every single specific detail. I don't have X-ray vision, but I can base off my testing, my objective testing, and what I've learned, I can do my best analysis. So I do help a lot of people off Instagram. I do think that there's a very big group on Reddit that talks about PRI. Yeah, PRI is all over Reddit. And people that are really struggling will go to Lincoln, Nebraska, which is where our institute is based out of, and they will do an intensive there essentially. And they will go for a week and they'll get a dental appliance, they'll get vision, they'll do that, they'll get orthotics for their feet made, they'll do everything. They get techniques are that's the treatment. But yeah, so people have found me more on Instagram lately, and a lot of times I am the last, like they've tried everything. They've been to like multiple chiropractors, multiple PTs. I've had people tell me they've seen 12 providers before coming to see me, and they've had like pain for years. And it's so interesting because those are usually hard cases, because if you go to a PT and you get better, then great, they did something that helped you. But I'm usually seeing with people that are really struggling.
Do physical therapists even know about, like, do a lot of like the ones, like, for example, like if you were to go to mainstream, physical therapy office
in New York City?
Yeah, in New York City, do they have any idea about PRI at all?
They might if they are open, but here's the thing with PTs, and not to generalize, but typically after physical therapists are done with school, they're pretty tired and they've spent a lot of money on schooling. Their education is expensive. It's the same with athletic training and chiropractic care too, but I do feel like there's a little difference with chiropractic and ATs because maybe because chiropractic has more reach, they can do more things than PT. I think a lot of times PTs after school, they have to want to do the continuing education. They have to stumble upon it and want to do it. And yeah, of course, there's tons of PTs. Most of PRI are PTs. It's me and one other person that are certified athletic trainers that I know that do PRI like at the level that we're doing it with vision and dental. I don't know any other ATCs that are doing it this way. I know licensed massage therapists that are brilliant and amazing, and I know personal trainers that do it at a high level. And what I think about that is that you don't go into debt when you do become a personal trainer. You just take, a year course or something like that, or you take a certification. And so you're more open to learning because you didn't just spend 4 years and $80,000 of your education learning. And at that time, when PTs are done with school, they just want to make money, which is totally understandable. So a lot of times they're not the first ones to be taking courses. That's my opinion. But the majority of people that do take our courses are PTs. We're getting a small group of chiropractors, and there's like no athletic trainers. There are a lot of strength coaches. And I think in the strength world, PRI is almost more known as like, let's start with this. Let's all do these repositioning drills before we go and do a strength training program. And that's been really beneficial for a lot of teams. I mean, I know that there are actual professional soccer teams that utilize this. And it's in a lot of places. It's just, I know there's MLB guys, there's football players, they use it. They just might need to find a specific person that does it to help them with it, because it's not that widespread. I know actually Arizona Diamondbacks, their athletic trainers are all certified PRI providers.
Oh, wow.
So
Okay.
I don't know them,
it's like,
but it's there.
rating.
Yeah, it's
okay. So
getting there.
Slowly getting there. So let's just say someone was to say, I want an appointment with you, and they have, I know you said chronic pain is a big patient, client population that you have. Yeah. When you say pain, what type of pain? We're talking about pain anywhere. We're talking about back pain. We're talking about joint pain. Are we talking about headaches, migraines? Are we just talking about generalized pain? What would you say in terms of pain? What do you see the most, like, is it joint related? Is it back related? What are you seeing with pain?
I do get people with overall body joint pain, right? And I usually am thinking things like rheumatoid arthritis type stuff or Lyme. Like, I'm looking at all those things, and those are the people that I will 100% do techniques with them, and it will help their nervous system. Because the techniques, yes, they work on these imbalances and getting you asymmetrical to be able to manage that asymmetry, but they really allow the body to get into a state of parasympathetic, which every single person needs. That just modern society. But I will also refer those overall joint pain people to naturopaths. That's what I just think. Personally, I think naturopathic medicine, like working with you, working with Veronica, it's been a real game changer for my practice to have that integration component, because I don't think it's a one thing fixes everything. And specifically with overall body joint pain, I think your field, that's pretty, they need that. They need that integration, but they also can benefit a lot from what I give them. It's not always going to fix everything.
Okay. So you're saying if it's widespread joint pain and you're like, okay, this looks more systemic. This looks like it's more Lyme or rheumatoid. You would obviously see a need for a naturopath to do systemic work. But what you're saying is your techniques can also be highly beneficial because it's just helping their nervous system, which from my perspective, you help their nervous system and everything gets better, right?
Exactly. So, yeah. The more I'm learning too, that's like the biggest thing. Like, that nervous system get into a state of cool and calm and be able to emotionally regulate. And because if not, it doesn't matter. You could try everything in the world. You can try a million of different modalities, but you might still be stuck. And that's where PRI does help with that regulation. So I will always refer out when I hear body joint pain.
Something that sounds systemic, but like, let's just say someone came into you for, like, let's give an example of, so the listeners can maybe think, okay, if I had an appointment with Alina, what does it look like? Like, give me a symptom that maybe someone recently came in with, and then what did you do to assess them? And then what did you do? Did you do, for example, what I'm most interested in is, are you doing actual exercises in the visit to help, plus they get homework? And are those homework, do they do them every day, or do they do them once every week, or how often do you see them? All this, like, these nuances I'm really interested in. Like, is it like almost like you're getting the therapy in the session with you, plus then they're kind of going home and then reinforcing everything?
Yeah. So is a really important component here. When somebody comes in, I do typically see a lot of the same symptoms. Chronic neck tension, that's huge. Everyone has chronic neck tension. Everyone's worried about their forward head posture. Everybody has either mid back or low back tension. Everybody feels stiff. Sometimes the right neck tension going up. Sometimes we get a lot of TMJ, dysfunction. TMD is really the term for it. And then things like hip pain. I get a lot of hip pain. So any of these things I could treat. And I look at every single person the exact same. So I do a movement analysis where I look at different things, passive and active. So I make somebody squat, but the squat's specifically done. It's not like a typical squat. I make somebody do their reaching towards the ground just to see how much their back can round, because it tells me different things. If you have a very flat spine and you don't have this rounding curvature in your back, I know you can't breathe there. And I'm looking to see, I look at a straight leg raise. How far can you bring your leg towards your face? If you can bring your leg all the way towards your face, like I used to as a gymnast, that's a problem. That means your pelvis integrity is like gone and I need to restore that. If you have no range of motion there, that's also a problem. That means your overall body tension is elevated. It's through the moon. So we have to also restore that and bring it down. We have to balance everything out. And then I do some other physical passive tests that might just look like, oh, I'm looking at range of motion. But the range of motion test is actually an analysis of how asymmetrical are you. And like, it looks like if I do a shoulder test, my shoulder test just looks like I'm looking at shoulder internal rotation. So that's just this motion for people watching. And most people, most PTs, most chiros that do not study what I do are just looking at, okay, that's a range of motion. That limited here is going to be problematic with certain movements. I'm looking at it as how can that person breathe into their chest? Because if this is limited, I know that they cannot breathe up here. Because once I teach them how to breathe, that changes. So I do all my testing, and then I usually start with one technique that I use a lot, or there's like 2 or 3 I use in the beginning a lot, that I just teach people how to breathe right then and there. And I dispel myths, because there's a lot of myths about belly breathing, and I have a lot of people come in like that do not know how to breathe at all. The majority of people today don't know how to breathe. Even the people that have done a lot of yoga and breath work, they're going to for sure be better at it. But there's been this skewed perception of that we need to be belly breathing, and it's not true. Your lungs live up into your rib cage, up into your chest wall. So we actually need air to fill into our chest without our neck pulling the ribs up. And that's the thing that there's just a terminology problem sometimes in the yoga world where they're saying, oh, people are doing chest breathing. But chest breathing to me is great. Neck breathing, where you're with your neck lifting up, is a problem.
So it's just the semantics between, you're just not supposed to be elevating, right?
Yeah, you don't want shoulders coming up towards your ears when you're taking an inhale in.
That's
we want chest
what the problem is.
Yeah, we want chest to expand forward and back to expand backwards, like anterior to posterior expansion. And so it's an issue with the terminology used, but it's also an issue with the fact that a lot of people teach absolutely no movement in the chest, and that is not how lungs operate.
Yeah.
So we need that.
Right.
Yeah. And then I teach a full exhalation. People don't know what that means, and people think they know how to exhale and they don't. A full exhalation and ability to do a breath hold actually shows an increase in lifespan if you can hold your breath. I've been trying to practice. Mine is not very good.
So wait, how long do we have to hold our breath?
You look at free divers can hold their breath for so long, and they have the longest average lifespan.
Wow. So how long is the average that people can hold their breath?
I don't know the average. I can look it up.
What's a good amount that would mean that your life?
I think if you could get to the point of like 1 minute, 30 seconds of a breath.
Do that later.
It's hard. I've been practicing. I have my own theories about why I struggle, which I can tell you, but I have a theory because I've worked on my exhale. I've been doing this for years, and I don't work on it every day, but I have worked on it, and mine does not get better. So I have my own theory about it.
You want to share your theory?
Yeah. So here's my theory. I'm 4'11". So the world is built for someone who's around 5'8". So what I have to do to work in this world, like even just cooking in the kitchen, everything I have to reach, every single thing. So what happens when I'm constantly reaching up is my rib cage is elevating all the time. I like the idea of reaching within a rib cage that stays down, but that's not going to be my worldview. So I have to go into extension. I have to arch my back and lift my ribs into a rib cage flare, external rotation all the time. So that puts my diaphragm in a more weakened or flattened position, which means it can't dome up as well, which makes it harder to exhale. So in order to train that, I need to exhale, fully get my air out, and my diaphragm will dome up internally. But I was a meconium aspiration baby. So I was a C-section baby, and I had meconium aspiration. I was on antibiotics and I was in the NICU for I think 9 or 10 days. So meconium aspiration is when you inhale fecal matter.
Yeah.
It's not good. It's not common. It's not super rare, but it's not super common. Mm-hmm. And so I personally, I'm really sharing with your audience.
Yeah. I love it. So we like this.
Yeah. I really think that I just have this deep theory that messed with my lungs. There's birth trauma there.
Couldn't, right?
Right. Because my first breath in the world was not diluted. Maybe it was filled with shit, literally.
Exactly. So you're right. Okay, no wonder why. And then being 4'11", like you're saying, that can affect your exhalation, which then, of course, you're saying that you feel like it's hard also for you to maintain even an inhalation for a longer period of time. That's so fascinating. See, this is why I love this topic, because every time I find your on Instagram reel of yours and watch some fascinating tidbit, what would you say? It like blows my mind. What would you say was the most controversial Instagram that you had? Was it the
very easy answer?
Was it the one with the bracelet?
Permanent retainers is by far. I get the most hate when I talk about permanent retainers, usually from TMJ specialists and orthodontists, but some orthodontists are open-minded. TMJ specialists are very, very specialized. And the problem with siloing medicine and specializing medicine is that you are shutting out people from working with you because you are so specialized, and a lot of people have egos that they can't understand and look at things from a different perspective. But when we have our own lanes in medicine and we can't integrate, we are never going to help that patient. So that is exactly what I'm against. Yep. I want to work in conjunction with other providers.
Absolutely.
And it's like when I work with dentists, it's hard. And optometrists, I'm coming into their world. I'm standing in their office and telling them, actually, I think let's do it this way. Let's try it this way. And they have to have an ego that's able to handle that. So, and for sure, me too. I get put in place too sometimes. Sometimes, optometrists are like, absolutely not. That's not going to work for this person. And I'm like, okay.
But that's you're learning, but you're willing to collaborate with people. But it's most of the time, it's like a doctor for every organ. So
that's the problem.
So it's like, while I really appreciate your expertise in the, in cardiac or respiratory or any other organ, right, or gastro, you have to be able to be open to how the body works synergistically and holistically. That's what obviously a naturopath is, right? But before I go into because I want to talk about why, like what people were saying about the whole retainer thing, but what does this dental world have to do with PRI, right? This is right. I want to make sure we talk about what is it, how is it correlated? And then because when you do talk about these dental things, just like you see, right, there's conventional dentists, conventional specialists and team, and then they get very upset and angry at some of the content that you do. But can you share from a PRI standpoint where the dental part comes in? And then also we'll talk a little later about where that vision comes in, because I know you mentioned ophthalmologist or optometrist.
I also forgot to finish the homework question. So
sorry. Tell me, do they have?
No, it's fine.
I know there's so much to talk about.
People might be like, "Hey, she talked about her birth trauma, but forgot to tell us what to do."
What else are we gonna do? We have two chatty New Yorkers here, so
I love it. No, I'll answer all the questions. So when it comes to like the appointment here too, so I teach them how to breathe, and then I do make sure that we do techniques here together. And I make sure that I really try my best to elicit a change in this session so that they know when they go home and do this stuff, it's going to elicit change at home. And then long term, the goal is that, yes, I send people home with 2, sometimes 3 techniques for homework. And then they do them for 2 to 3 weeks. And then they come back in and we reassess and reevaluate. And if there's no change within a certain amount of sessions, usually 4 or 5 with me, I try not to go further than that. I really try to get people's bang for their buck and also not stretch the treatment out for like months at a time. But then I will go to dental and vision if necessary. And it's so much better to start in person with me here or online, just doing techniques. You need to start with techniques before you do anything dental and vision, because if we jump to dental and vision first and we don't have the body foundation, that can cause problems.
Oh, okay. So really important. Okay. So
here's your question about,
okay.
Yeah. So it is so extremely important order of operations. You have to get your body into the right position, because now to talk about dental, if I have somebody here that has a forward head posture, okay, and they went straight to a dentist, and now a dentist said, let's put you in a splint to pull your bottom jaw forward. You're pulling that bottom jaw forward on an entire body that is falling forward in space.
It's ready.
So now a lot of times we will see a problem, or maybe their symptoms will get better, sure, but the rest of the body was never addressed. So now something else might pop up. Now they might have some problem with their foot, because now the whole body is even more forward in space because you pulled the jaw forward. So that's where it gets very complicated, and I have to work with very specific people who understand that the body is so important. Because if you're a TMJ guy and you're putting somebody in a splint, that's great. and you might make some symptoms better, maybe, but you might cause some problems lower down the body. That back might blow out. We might have an issue with the hip, and they're not asking those questions. So you have to start with a provider like me or start online. And it's so super important. And their basics are foundations. Like some people, we can start with the same couple techniques for the majority of people, and then we can make it more specific for people.
Okay.
Depending on.
So do the holistic biological dentists pretty much know what you do, or did you have to introduce it and then they're like, wow, this is actually amazing and I need this for our patients?
Yeah. It is actually, okay, this is how I explain dentistry. It's going to answer this question. I explain dentistry as there's like three main types. We have the holistic biological dentists that are really great when it comes to amalgam removal and the actual tooth and what composite filling they're using instead of using better chemicals, better ingredients, better quality there. But when it comes to, I'm looking at then there's airway dentists that are going to be good at like palatal expansion, and airway dentists and orthodontists together. And they're looking at how far is the intermolar width. They're looking at structure, biomechanical structure, making sure that a kid developing is getting that palate, which really in our time growing up, that wasn't a thing. This has become a new thing. It's really blown up in the last 20 years. And it's a huge field. So that's another type of airway dentistry that most kids, also adults, are using. And people as adults are getting palatal expansion and making changes there. And then there's the PRI people that see that there's something with PRI and they're dentists and they want to integrate with PRI providers. And they're open to doing that because they see the body. There are not many PRI, I put it in quotations, hand quotations, because there are not many PRI dentists that understand that. So essentially, me as a provider, I have to go out to the dentist and explain to them what I do. I've had to do this 3 times. Yeah, I've had to do it a couple times. I've worked with a few dentists. I have 3 in New York City that I work with. I have worked with people in the holistic world. I do send people to biological dentists when they need tooth-specific things, not airway-specific things. I have not seen any successful stories when it comes to doing airway work with a biological dentist, to be honest. And that's my honest opinion. And
yeah,
that's
I'm happy to hear that. Yeah, I want to know exactly who's kind of like privy.
If it were my kid, I would never send them to a biological dentist to do an airway dentist job.
Okay.
I would do very separate. I would go to an airway dentist if I'm concerned about my kid's sleep. And if I'm concerned about what filling they're getting, I would go to a biological dentist. I have not really found one that does it all. Okay. The dentist that I'm starting to work with, she's more open to the biological dentistry. And so that's really cool because she's like, yeah, sure, I'll use that material. But she doesn't classify herself as a biological dentist. So, and that's fine. There are conventional dentists that are out there that will not use fluoride if you ask them not to.
Yeah, I've gone to conventional dentists and I say, can you please not use fluoride in my mouth? And then they say, okay. They really don't argue with me. I don't really know. I have to say, I don't think I've had one dental office that really argued with me when I said, do not put fluoride in my mouth. So they're just willing. And also I had a dentist here. She's a conventional dentist and I think she said to me, oh yeah, I don't even remember. I think we were talking about sending a patient to get like mercury out of their mouth. And I said, but do you have the proper filtration, like that hood that filters mercury out? Because otherwise you're vaporizing the mercury into the air. The dentist can get potentially poisoned. The patients get.
Yeah, they don't realize that, right?
And when I told her that, she was like, oh my God, I never knew that. I never thought about it. I sent her the information to like look into the biological dentistry stuff. And the next time I was there, she had one in her office. So it was like,
oh my God, no way.
And she was actually talking to me about trying to convince me to do that palate expander thing. So there are some of these conventional dentists that are open to hearing. I mean, some a little bit more closed-minded, or it just really depends on who you talk to, but they are open. I have to ask you, this has been a burning question. Do you, and I don't know if you know the answer to this, someone who's had a root canal, do you see any balances PRI wise, or do you not, that's not kind of your area?
No, I don't look at that from a structural perspective, but because I'm me and I'm holistic myself, this is where I'm different from a lot of other of my colleagues, because, and not a lot of them, some of them are also pretty holistic too, but my form is really in depth. I'm not asking now. I need to ask, actually, have you had root canals and amalgam fillings? I ask in session because I want to know, because if they're coming to me and they're struggling with pain or sickness, because most of the time they're intertwined. You don't usually have debilitating back pain without anything else in your history.
Inflammation.
I just don't find that. Yeah. Right. So I ask and I look to see if they have amalgam. That's for sure. I educate on amalgam. I educate on root canals. I will say if people have had tooth pulled with no implant replacement, that's where I see problems. So I'm a fan of getting an implant replacement and not leaving a hole because it is off.
Absolutely.
Your structure will be off.
Absolutely.
So, and a lot of biological dentists don't really recommend that. Like sometimes they'll just say, oh, well, let's just not do an implant if there's a financial constraint. But first of all, we have something called super eruption where teeth have to meet. And if one tooth is here and there's no other tooth up here, it's just going to keep coming up to try and find its ground. Your mouth is your second ground. Your first ground is underneath your feet. So if we are missing that contact, the brain will figure out a way to find contact and will move. Your teeth will shift. So I do really educate on that. That is one of the things I ask. I ask about braces. I ask about palatal expansion as a kid. I go in depth with that. Actually, I had a patient yesterday who had 7 mercury removals done improperly. She got mercury poisoning.
See what I just said, right? When they go into regular conventional dentist and they get,
I did that. I had mine removed, and it was went to a biological dentist in Texas, and they didn't do it properly, and they filled it so big, like not properly, that it's too big for the space. So I had sensitivity for 2 years.
Oh no! See, this is why you need to go to a biological dentist if you're going to get your.
That was a biological dentist. You have to vet your.
Yeah. Oh, wow.
That is that.
So this is, but then that scares people even more. They're like, okay, well, now I'm trying to go. I'm spending all this money.
I know.
That's why it's like, find people that are referred.
You have to go to somebody who's referred from another person.
Find referrals.
Go on Google.
Yeah, because it's scary, because technically if a patient tells me that they're going to get mercury removed, I then start draining them before, and I start opening up their pathways of elimination.
I actually did that. Well, I sort of did. I did medical medium. I took his heavy metal detox smoothie every single day for like 2 months.
Okay.
I got really into it. I was like, okay, I'll do that.
Medicine. That's good. Listen, for a person who doesn't, like, let's just say didn't have a naturopath telling them what to take, taking foods that remove heavy metals from the body. I'm always for food for medicine. Like, let's say in hindsight, I would have been like, okay, Alina, let's get you on this homeopathic drainage combination. Let's start opening up your detox pathways, and then when you get them right, then we can do more draining and potentially binding. But that's really good to know that it was. Because people think like, oh, every naturopath has to be the best. Every biological dentist has to be the best. No, because there's quite a bit of naturopaths that are not practicing the way that I would practice, right? So
exactly,
it's like, find a referral. Most of these people will do kind of these 10-minute or 15-minute free consults just to get it. Sometimes you just need to get an idea. You need to just talk to someone. That's why I personally don't even take on patients anymore unless I actually speak to them for 10 minutes, because I want to make sure that we jive. I want to make sure that our personalities work together. I want to make sure that I can help them or they want to get help. My mentor used to always say, every disease is curable, but not every person is, right? Because
that's huge,
right? Because some people don't want to get better. Some people have a secondary gain to their illness. It keeps them, safe in other ways that they're subconscious. Yes, exactly. So when you were talking about this permanent retainer thing on Instagram and people were losing their minds, but some of them were right. I read some of them were like, yeah, that was the best thing I ever did was get it out.
Yeah.
What was it causing? A lot of headaches and migraines? And
permanent retainers can definitely cause headaches, but you have to think of this. If we can't oscillate right versus left, and we're not neutral, let's say we get that permanent retainer done. We're 17 years old, 16 years old. We just came from a soccer game or something like that. Or we just came from taking a test. So you're staring at a screen. Let's do that. Your body tension is up. You're getting that permanent retainer installed. And your body is more dominant over on your right side with your head in a little cocked position. And it's neurological. It's not something you might even be able to see. It's a test that I can feel. And now we're gluing the teeth there. Now the cranial bone movement is going to be a little limited because that those teeth, how they touch, influence how the cranial bones move. Whether or not TMJ and dentist people think that, because sometimes they don't. You'll talk to dentists and they'll be like, no, cranial bones don't move. So that is, but craniosacral therapy is based off cranial bones.
I was going to say that
it really
actually was trained in I did the Upledger craniosacral one.
Oh, really? I think I'm going to take it in 2 weeks.
Upledger is the best. I did it when I was in naturopathic medical school. I loved craniosacral, and I did the Upledger one. I just don't practice because I'm in the state of New York. Technically, you have to have, they don't license naturopaths. So like if I wanted to do craniosacral therapy, I'd have to be in the states that I'm licensed. So for example, Connecticut, California, but Upledger is one of the best. I was going to say craniosacral wouldn't exist if we didn't think that the cranial bones had the ability to shift. Yes. It would not even be a thing. They would be big.
But yes, so that permanent retainer will lock up a cranium so that the person can't move the rest of their body right, left. And then we're going to see whatever problem that person is, whatever. I mean, I have theories that whatever happens, like if somebody has right knee pain, if you look it up in like the emotion code stuff, I think it's emotion code. Veronica has a little book to it. Why are they getting it on the right side? In a structural world, it's because the body is stuck over on the right leg and can't come off. But why? Why didn't they get it on the left side? I think there is always an emotional component. So whether somebody has headaches, whether somebody has knee pain, there could be a lot of reasons, and it could be tied to the permanent retainer. It could be tied to palatal expansion. It could be tied to a lot of things. But people think that we need a permanent retainer to keep our teeth straight. And what we need is our body to be able to move and oscillate so teeth don't move. I have not worn retainers on my teeth in a solid, I don't know. I took them off I think I didn't wear them. And then I wore them a little bit for in 2018. And then I stopped. My teeth have not moved an inch. They're perfectly straight.
Oh my God. I'm so jealous because they gave me retainers. And then now my bottom teeth are, because I don't use them anymore, are starting to shift. But now I'm like, well, the worst
position. That's a big component.
Yeah.
Tongue position. That's why I work with myofunctional therapists who help with tongue placement. Speech and language pathologists are great, but if they don't have the myo influence, if they're not looking at what the tongue does and they're only looking at how the speech comes out, they're going to be missing components. So I work with a few, but I work with a SLP that has a focus in myofunctional therapy and a focus in picky eating, and I have found that myofunctional therapy, when it comes to shoulder injuries, I have a patient that I was so stuck on him. The myo helped him the most, and it was fascinating. And it was because he had so much he had adenoids taken out, tonsils taken out, nose rhinoplasty twice, so much. I remember my mentor said you could run the New York City subway system through his face. That's how open he was.
Wow.
Because he had so many surgical things that the pressure management up here and in his larynx was off. And how do you reteach that? Myo, tongue position, you get negative pressure when the tongue comes up to the roof of the mouth, and using a straw for drinking, different vocal sounds. It's just, and with work, he got better. So it's,
You're
really
about the people who, I think I had to work with a myofunctional therapist before that tongue tie procedure.
You did it?
I did.
Yeah, we can talk about tongue ties. That's also
yeah. So I was convinced that one of the reasons that I had, after trying to figure out, at this point, I didn't know that, yes, I had Lyme and I had all the trauma stuff that was 100%, influencing all of that pain. But I didn't at that point know that I had a Chiari malformation. So I was like, okay, it must be my tongue. Because then I got a bunch of people convincing me it's my tongue tie. And I've had a little list my whole life. And I was in speech classes when I was a kid. So I was like, well, maybe. And everyone's like, oh, you're going to feel so much better. So I actually went to the Breathe Institute, Dr. Zaghi, which I love him. I think he's amazing. He's amazing. I have to say, and I really hope he hears this, he was so kind, because from a child with childhood trauma that I had to be very careful about doing this type of surgery. And I shared it with him, and he was so compassionate, and he was like, okay, I want you to have a craniosacral therapist in here doing the snip. So he also made me, beside the 5 myofunctional that I had to do, 5 to 10 that I did before the tongue tie surgery, I then had the craniosacral therapist do it. And I have to say, when he snipped, I had a whole body like feeling of like emotional release. Like I started crying. And then she felt my whole, because she, they always say the fascia. And I know there's like things back and forth about this. It's tongue tie is good to have or surgery, then it's not good to have.
I'll give you my thoughts.
So I did it. He said to me after, I want you to know that, actually, he did say, I have to remind him this. He's like, when you feel better, we're going to write a book about this. This is actually what he said.
Wow.
He goes, this is not the whole story for you. You need a palate expander, because I now have this hypermobility, potentially Ehlers-Danlos type thing. And people who have that also have very narrow palates. He's like, you need to expand your palate. But with a person with the trauma that you've had, you would have to do like an ALF device, which is not like one of those big, thick, atrocious. I know if anyone's done it, I'm sorry, but that looks atrocious to me. Putting that big, horrible metal thing in your mouth that I would probably gag with, So he was like, even though the ALF device it's going to take longer and it's going to be a little less invasive. It's going to take a while, but it will start to open up that palate. But I was just so overwhelmed. When I wrote a whole post about like, when you just have healing fatigue, you've already gone through Lyme.
I have been there. I get it.
It's like now the tongue tie. Then I was like,
I'm not doing this right now. I'll do it later.
I couldn't do it. And it was in the middle of COVID, and he made me call a dentist who is the only dentist who does osteopathic manipulation to you while you are getting your ALF, I don't know, adjustments. And this guy was super nice, but I can tell I was like, I don't think I have the bandwidth at this time. So that's why I can't say did the 100% the tongue tie help my headaches and migraines. But I will say I did for like 4 months after. I did feel a lot less tension in my head. But he's like, don't come back to me and say this didn't work because you have to do the other part, what I said. And I haven't got back to him because I didn't do the other part that he said.
So should we send this to Nora Zaghi?
Yes, I really Zaghi. So
I haven't met Dr. Zaghi, but I've met Nora, and oh my goodness, they're so nice. And I absolutely love going and visiting with her. And it's really funny you said that because I just messaged her today because I saw a virtual patient who's in San Diego who I'm sending to her. So I'm going to message her after this and tell her that we talked about them. And we'll send them this podcast. So they are so nice. And also they're doing some absolutely amazing. He's doing some research and they're getting information out there. And I really want to connect more with them about what I do. And if I come out to California, I will, because this is where I think he's right. The tongue tie, I think that there's a missing link with what you were just talking about. And I think that I'm the missing link.
I know.
Because if your body can't oscillate side to side and you cut the tongue, like kids all the time, we hear this, the tongue will reattach. Now, I don't know if that's what's happened to you or whatnot.
Mine did. Let's look.
It probably not. No, it doesn't look like it did.
And he does an
amazing job too. He's an amazing surgeon.
That's why I went to him.
I'm like, patients. I have only ever heard amazing things. It's unfortunate I haven't gotten to meet him yet. So I'm excited for when I do. But I think that, and he knows about postural restoration too, but when we do the tongue tie release, yes, craniosacral is super important. Yes, myofunctional therapy, like that's something he does that other people don't do. People will just cut the tongue and not send to myo, but myo needs to happen before and after.
Yes,
but what I see with the rest of the system is if that body doesn't know ground, it won't totally matter if the tongue is cut. And how I like to explain the frenulum is like if you had a lot of maps like on top of each other. So one map is buildings, one map is mountains, whatever. And there's a line through all those maps. That orientation, that line tells the person their orientation, tells you where all the maps are located. That's what the frenulum does for people.
So frenulum is your little, maybe to tell people what that is, because in case they're not.
It's like the thing that connects your tongue to the floor of your mouth, essentially. And what a tongue tie release is that the frenulum is over tightened. And it can happen a lot with people with MTHFR. Yes. And I'm also tongue tied. I have a grade 3 tongue tie myself, and lip ties and buccal ties. I'm tied everywhere. But I know I am, but I haven't dealt with it yet because I want to make sure that my body is in as best of a grounded position first before I do anything like that.
So can you do your own stuff to yourself, or you have to have a person do it?
I do techniques. I can't evaluate myself, but I know what techniques feel really good for me. And I know that like with my own dental appliance, like I have to sleep in that. Like I feel really good. Now I could probably take time off. And my glasses, I mean, I have an optometrist look at me. I've had multiple optometrists try to figure me out. But and we've made progress for sure. And my dental appliance, yeah, I use a dentist who knows me, and we do it standing. So all of these things, I can do that stuff on myself. I could do the dental appliance on myself, but I can't. The vision stuff, you have to be like, okay, I'll just
trust get evaluated. So can you actually tell me how the vision is intertwined in PRI? How is that? I know you keep saying vision and optometrist, ophthalmologist. How does that contribute?
Yeah. So it's like the same thing with dentists. Like what I was just talking about with the tongue tie, we need to make sure that the body is grounded and has this ability to shift side to side, essentially before we go see an optometrist. Now, not every single body is able to get to a state of what we call neutral before these things. Like sometimes we need the dentist and the optometrist before to get them neutral. But the majority of people, if we have a bell curve of people, I'm saying 80% of people, I want to get to a state where they do my techniques first and then we go. So same with vision. We will work with the optometrist to find the best prescription for somebody. So one of the things that we do that I've been working with optometrists here in New York for like 3 to 4 years now. And they add in a specific testing, but we do it standing, or we do it after they've done some techniques. They'll do 1 or 2 techniques with me. I'll get them into a state where I test their body and they're neutral on the table, meaning that my objective tests show that their body knows where the center of mass should really be in center. And then we retest them in a standing posture. So when it comes to being overcorrected, a lot of people in general, one of the easy things to talk about is when you sit in an optometry chair and you put your head forward and you put your chin into the little thing and they bring the phoropter up to your face, they block off peripheral vision because the phoropter.
Wait, what
phoropter.
Is it called?
Yeah.
Phoropter, actually.
Phoropter. Yeah.
I don't know why it just made it like Friday end of the week delirium. The phoropter. Okay.
Yeah, no, it's fine.
Sorry.
This was all a learning curve for me too.
Okay, so you put your eyes.
That's why I don't like to stay in your lane, right? Because you're learning. We are always learning.
Yeah.
But yeah, they bring it up to your face and they shut all the lights off and they say, okay, look at this letter R. That is not how our visual system functions. Our visual system functions in day to day when we are walking and moving through space. We don't have lights off all the time when we're walking and moving through space. We have lights on. Or we're outside, we're walking, we have peripheral vision. Better peripheral vision is going to help with that binocular vision. So we want those eyes to team together and work together with essentially a bite that also knows that the teeth know where their mate is, their top to their bottom. So when we have, what I've noticed is a lot of people that have bite problems, like cross bites or missing a tooth here and never got an implant, they're going to most likely have visual problems, but it doesn't always go the other way around. You can have a vision problem and not have a dental problem. So yeah. So I work with the optometrist to find the best prescription for that person. So I will test the body with what the optometrist finds, and we work together really to find that prescription. I don't necessarily tell them what prescription to use ever. They choose a couple different things. And then sometimes I'm like, well, what if we tried a little bit more here, a little less here? Can that person tolerate it? I'll give my opinions based off what the prescription can do to the body. If you put a little more plus in one eye, it'll change how the posture is of the body. So when people say like, oh, you know, my prescription went down like almost nothing, 0.25. To me, that actually is a lot because it can make a really big shift in your system. So even just changing the prescription for somebody can lower their overall stress. Yeah. And sometimes adding, like for somebody like you who gets migraines, some people might need a little plus. Like these are my, not these glasses, but sometimes if you give plus to somebody, it tones down their entire system and it calms them. So it's really interesting. And that's where I think when it comes to treatment, there's really missing links. And I want to be that middleman person that helps people go where they need to go. So almost always when someone comes to me, they always get a referral somewhere.
So you were saying that even a small amount coming down in their vision prescription, that's a huge improvement, you're saying, because that can have very big
Well, it can also like just, it could change how that person moves in space. And so we want to make sure that the person can move functionally on both sides. So that's where the visual system can really come into play. And your visual system controls so much about your balance, your proprioception, your spatial awareness, your depth perception, and how we function in life. And when there's a issue with that visual system, the rest of the entire body will know it, even if you don't logically know it. I know.
It's like unbelievably fascinating.
It's cool, right?
Yeah. And one thing I just wanted to add, because you're talking about vision, and it's kind of, I'll never forget this story. I don't think I shared this on a podcast. I had this mentorship in Arizona, and he was a naturopath. He was a dentist that then became a naturopath. He lost his license because he was not doing a standard of care, and he gave homeopathy to a patient when he was a dentist, which is wild, because you're like, that's amazing that this dentist gave homeopathy. Amazing. So then he became a naturopath, and he was telling us, we were on a shift one day or one of our mentorships, and he said that he made the class of students every night before bed. And I know this is not PRI, but when you're talking about vision, I just feel like I have to share this. He said to put a drop of castor oil in the canvas of your eye, right? Like right closest to your nose, and do it for 1 month. So the student after 1 month came to him who had glasses and was like, I don't know what you did to my eyes, but you ruined my eyes because now I can't see out of my glasses. And he was like, take your glasses off. And then she could see perfectly. So I've
heard that about castor oil. I've been wanting to play around with it. I don't have a strong prescription, but I think I will. I have castor oil. Like what's
the harm? I cannot say that's going to happen to everyone, but if, for example, if just someone has like eye inflammation or an eye infection, of course that can help. But also if you're wanting to work on your vision, and doing some of the things that you do, and some people wear those, like, what do you think of those glasses with the holes in them? Those little, like, have you ever seen those? Do you know what I mean? I think so. Yeah, because there was a guy in medical school. We always used to laugh at him in a cute way, not making fun of him, because he used to always come to class with his little pinhole glasses because he said it was improving his vision. Is that a thing?
I don't know if that's necessarily a thing, but you will, if you do have a vision prescription and you do put those on, you will see clearly through those holes, but you can't walk around space with them.
Okay.
I know that
we had those on all the time.
I actually had blurry vision in one eye when I was in Arizona a year ago. And my optometrist was like, you need to go see somebody. She was like really getting worried about it. And I was like, no, I'll just wait to come home. Yeah. And then I waited like a month and a half, and I came home and she put those on me, and she's like, can you read the thing? And I saw it perfectly. I was like, what did you just do? Like, how am I not blurry? Because I was blurry with my glasses on. And she was like, you're fine. You're in like a spasm or something like that. But because I could see through the pinhole glasses, like I actually didn't have any like maybe neurological problem or a brain issue that she was trying to rule out.
Right.
So it was kind of interesting. Yeah. But I mean, I could get more information on that. But also you can improve your vision by looking out in the distance.
Oh, like just yes.
Using your eyes to look in the distance. So instead of always doing near work. We do so much near work.
What about looking up? You know how like we're always looking down? It's good too, like to have something that we're looking up and move your eyes. And also what you're wearing right now, if you don't see this podcast, she's wearing these really super cute, they're blue light glasses, but they're orange. They look so cute on you. So what are the ones that you like?
Yeah.
You said
these are. Yeah, they're called Raw Optics, RA Optics, but there's a lot of different brands. I know Bond Charge makes, I just found another brand that I'm going to try out next week, but these block 100%. No, these are 95%, but the red ones block 100% of artificial blue light. And why it's important is because we're not meant to get blue light in isolation into our eyes. We're meant to get blue light in the morning. It helps to stimulate melatonin release in the evening, but we're meant to get it in combination with near infrared light and UVA light in the morning. And so at night, it's 4:30 here. I'm doing a podcast with you. I don't need this artificial screen.
You do not need that.
Getting into my eye. So that's why I really try at night to wear them. And I'm actually going to go out tonight and I'm going to wear them. And I will get made fun of. And I absolutely do not care.
She's like, my sleep matters. And I do not want to get a text later that I ruined your sleep because of your lights in your eyes from the podcast. So tell me, Alina, a little bit to close because we're almost at time. Would you say the Rooted Well platform, who would that be beneficial for? I know you have it on your Instagram page. You speak about it all the time. So can you share a little bit more about that?
Yeah, Rooted Well is like my baby that I have worked on for 2 years to just get as much information as possible, videos, interviews, techniques from PRI out there so that people can get it. Each Rooted Well platform has about 55 videos, something like that. And it's not even perfect. It's just, I put it out and people are telling me they really like it. So the people that can benefit the most are essentially people that do not have providers near them, that live in places where they can't have access to a provider, can't financially afford a provider, have to start somewhere and don't know where to start. This is where you start. So you can start with basic techniques that help you get into what we talked about today, into that neutral state. And then there's also educational videos explaining more in depth of what I talked about here. And Rooted Well Foundations is more about pelvis, ribcage, feet. And Rooted Well Advanced is going to be more about myofunctional therapy, dental, optometry, and all of these components. I'm also I'm starting to work on primitive reflexes too. So I'm going to probably put that in the foundations one eventually. So
that's incredible. So basically, if you are not in an area where there's someone you can see in person, this would be good for anyone virtually, or even if you could, just to basically solidify and also bring home a lot of the concepts that you teach them. So you can either be seen in person in Long Island, in Manhattan, and then you have this virtual platform, Rooted Well, which is a nice community. And then I can't wait. I'm very disappointed because the day that Alina
come over, the fires came
to my house in California to do a postural restoration appointment with me, California unfortunately started to go on fire. So I had to evacuate and drive to Arizona 8 hours. And so we unfortunately could not do it. But I'm hoping if I could see you in New York soon, we can maybe do that, or the next time I see you, because I'm super interested in this. This is absolutely not only interesting, but I feel like it's like missing pieces. Like I love this because naturopathic medicine is a missing piece to a lot of what people do conventionally. And so when I see this little niche of something, I'm all over this. So as you know, have been experiencing headaches and migraines for most of my life. So Alina wants me to do a session with her so that she can see if she can find something going on. And I'll make you guys laugh just to close. She wanted me to buy these sneakers.
The one.
That she said that if I have better sneakers and shoe support, that it will support
helps with neutrality,
my head and neutrality. And I texted her, what did I ask you? If they were ugly, and if
you said they're ugly, which like, okay, you're not like wrong, but shoes also have a lot to do with it. We didn't really talk about that here, but it's my first go-to with people. I always get people in a good shoe before we do anything else.
So good shoes are foundational. So I did buy them, even though I have to say the one that I thought they were both going to be ugly. One of them was ugly, but the other one I actually liked. So I'm probably going to keep that one because there was like, you gave me a list, which I thought was awesome, of shoes that could be helpful. And then you wanted me to try them and see which felt comfortable. The ugly pair, fortunately, did not feel comfortable. So I was happy about that. I mean, you're dealing with a New Yorker who walked around Manhattan in stiletto heels. And now you're like, I'm just wearing like aloe sneakers or like some whatever. And she's like horrified.
I can't. Between you and Veronica's closet of shoes, I'm done.
We asked our Veronica to also buy ugly shoes. And she's
like, no, I have 40 pairs of shoes. I don't need more.
She's like, I'm not doing that. So, okay, that's actually good to know. So foundation is absolutely shoe work, and you'll do that with people, because I hear a lot of my patients are going like chiropractors, because no one else is talking about their foot, and like going to chiropractors. And even I have to say, some of the chiropractors, at least they're offering them good insoles or like sneakers, or they're the only ones really talking about that with them. So I'm happy that you also are talking.
Yeah, I have a free ebook. It's like 48 pages or something like that I worked on. And it's all about shoes.
Oh, you have an
ebook. I'll send you the link and you can link it.
Okay, perfect. So when I send out my the email blast to everyone, we'll put that link, and then I'll also put it in the podcast notes, and then anything we share on social media, we'll put that. Any other closing thoughts that you want everyone to know about PRI that we didn't talk about? so far.
No, I think we got it. Dr. Sue is the best.
Oh, thank you.
And thank you so much for having me.
Oh, I'm so happy you were here. I love that you're an expert in this. I love picking your brain. Thank you so much. I'm sure everyone is going to get a lot out of this. And if you have any questions for us about anything we talked about, you can DM us on Instagram. You can definitely talk to Alina and help answer your questions. So thank you so much, Alina. Have a wonderful evening. Talk to you soon. Bye.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.